Hello friends, welcome back to Complete Medical Coding. Let's discuss few questions, more questions from HCPCS. HCPCS codes and HCPCS modifiers we can discuss in this chapter. So friends, if you are new to the channel, please subscribe me and please press the bell button so that you will not miss any videos. So let's have a look into each and every question one by one. So let's move to the first question. A 66-year-old Medicare patient who has a history of ulcerative colitis presents for a colorectal cancer screening. The screening is performed via barium enema. What HCPCS level 2 code is reported for this procedure? So here we have to code for the HCPCS code for colorectal cancer screening. Okay. In HCPCS you will be getting only 3 questions. For this direct HCPCS codes, only HCPCS codes questions you will be getting. You can easily score 3 marks also for the 3 questions. Okay. So let's move to the options one by one. What is G0106? G0106. G0106 represents colorectal cancer screening, alternative to G0104, screening, sigmoidoscopy, barium enema. What is G0105? Colorectal cancer screening, colonoscopy on individual at high risk. This one we need history of ulcerative colitis. Okay. What is option C? G0120, colorectal cancer screening, alternative to G0105, screening, colonoscopy, barium enema. Yeah, this is colonoscopy. Screening is performed via barium enema. Yeah, colorectal cancer screening means colonoscopy. Screening colonoscopy. Okay. For the code G0106, it is screening sigmoidoscopy. We need screening colonoscopy. What is G0121? Colorectal cancer screening, colonoscopy in individual not meeting criteria for high risk. No. So here our correct answer is option C. G0120. For screening colonoscopy. Okay. Now let's move to the second question. Patient with corneal degeneration is having a cornea transplant. The donor cornea had been previously prepared by punching a central corneal button with a guillotine punch. This had been stored in Optizol GS. It was gently rinsed with BSS plus solution and was then transferred to the patient's eye on a pattern spatula and sutured with 12 interrupted 10-0 nylon sutures. Select the HCPCS level 2 code for the corneal tissue. So here we have to code for the corneal tissue. HCPCS code for the corneal tissue. We can directly go to the options one by one. What is V2790? V2790 represents amniotic membrane for surgical reconstruction per procedure. V2785, next option. 2785 represents processing, preserving and transporting corneal tissue. What is our procedure here? Corneal degeneration. Is having a cornea transplant. Yes, cornea transplant we need, right? So 2785 represents preserving and transporting. So that will be the answer because transplantation. Let's look into other options as well. V2628. What is 2628? V2628 represents fabrication fitting of ocular conformer. No. What is option D? V2799. 2799 represents vision item or service miscellaneous. No. So here we already got the answer as V2785. Option B. V2785. Now moving on to the third question. The patient presents to the office for an injection. Joint prepped using sterile technique. Muscle group location gluteus maximus. Sterilely injected with a 1 cc Kenalog 40, 2 cc Marcaine and 2 cc lidocaine 2%. Sterile bandage applied. Choose the HCPCS level 2 code for this treatment. So this is little easy. This is for the injection. Patient has been presented to the office for an injection. Okay. and sterile injected with a 1 cc Kenalog, 2 cc Markin and 2 cc Lidocaine. Let's move to the options one by one. What is first one? J3301 times 4. What is J3301? J3301 represents injection triamcinolone acetonide, not otherwise specified, 10 mg. Okay, times 4 it's mentioned here. But here in the description it is 10 mg. What is J3301? Option B, same. What is J3300? Option C, J3300 represents injection, the same procedure, the same injection, preservative free, 1 mg. Okay, we have here sterilely injected with a 1 cc, 2 cc and 2 cc, total is coming 5. So up to 10 mg we can code only one, that which is the code J3301. Okay, no need that times 4, which is mentioned in option A. So directly we got the answer as J3301. It is in option B. Now moving on to the fourth question. A 10-year-old male sustained a Colles fracture in which the pediatrician performs an application of short arm fiberglass cast. Identify the HCPCS level 2 code that would be reported. So here the procedure is application of short arm fiberglass cast. Application of short arm fiberglass cast. So first option Q4012. What is Q4012? Q4012 represents cast supplies short arm cast pediatric 0 to 10 years fiberglass. Yes, this is pediatric only, right? 10-year-old male. Pediatric. Here it's mentioned in the bracket the age 0 to 10 years on this code description. So this will be the answer, fiberglass cast. Still, let's move to other options as well. There is one more Q code in option D, Q4024. What is Q4024? Cast supplies short arm splint pediatric fiberglass. This is not splint, this is short arm cast. Okay, so don't be confused with both those words. Read carefully the question initially. What is in option B? A4580. A4580. What is A4580? A4580 represents just cast supplies. Example, plaster. And what is A4570? It represents splint. Cast and splint. But no, the proper description is there in option A. So our answer will be option A. Q4012. Now fifth question. A 35-year-old female is having an IUD insertion. The IUD type Mirena. The HCPCS level 2 code is. So here Mirena insertion, IUD insertion. So let's look into the options. So what we need to code for the IUD insertion code. Okay. What is option A? S4989. S4989 represents contraceptive intrauterine device. Example, progestasert IUD, including implants and supplies. No. What is option B? Option B, J7298. What is J7298? Represents Levo, nogestrone releasing intrauterine contraceptive system, Mirena, 2 mg. So we got Mirena is the IUD type. So our correct answer will be option B. We already got the answer, right, as Mirena. So this will be the answer, option B, J7298. If you want, you can just check the other options as well. One more J code is there, J7300. It just represents intrauterine copper contraceptive, which is not the answer. And what is option C? A4264. A4264 represents permanent implantable contraceptive intratubal occlusion device. That's also not the answer. The answer is option B. Now, sixth question. What is the code for supplies for a two-way silicone Foley catheter? Two-way silicone Foley catheter. That one we need to code. What is option A? A4311. What is A4311 represents? Insertion tray without drainage bag with indwelling catheter, polytype, two-way latex with coating. Let's look into other options as well. A4312. 4312 represents insertion tray without drainage bag with indwelling catheter, polytype, two-way old silicone. We need two-way only, right? Two-way silicone. So two-way old silicone. This will be the answer. Two-way silicone. The first option is two-way latex. What is option C? A4314. Same two-way latex. The same description with two-way latex. This is also not the one. And option D, A4316, which represents three-way. So that is also not the one. Okay, insertion tray, polytype, three-way. So we need here two-way silicone folding, which is there in option B. So the answer is option B, A4312. Now moving on to the seventh question. What is the code to report 1 mcg of Aranesp for a patient on dialysis with ESRD? Let's move to directly to the options one by one. These are J codes. Okay. So this is also injection. What is option A? J0881. J0881 represents injection darbepoetin alpha 1 mcg. What is J0882? Injection darbepoetin alpha 1 mcg for ESRD on dialysis. Yes, for ESRD we need. What is option C? J0885. Injection epoetin alpha for non-ESRD use. No, this is ESRD. What is J0887? Injection epoetin beta 1 mcg for ESRD on dialysis. But this is some other injection. We need Aranesp. And this darbepoetin alpha is another name for Aranesp injection. Okay. Aranesp injection, another name is darbepoetin. This is anatomical question, but it's okay. Once in a while you may be getting this type of questions if you are not familiar with the medical terms, medicines or anything. Okay. So here our answer is option B, which is J0882 for ESRD on dialysis. Injection darbepoetin alpha, which means injection Aranesp 1 mcg for ESRD on dialysis. Now moving on to 8th question. A patient has an insulin pump of 100 units. The pump is filled. Which code reports the supply? So insulin pump, we need to code. What is option A? J1817. J1817 represents insulin for administration through DME insulin pump per 50 units. So 1817 represents per 50 units. We need this one only, right? But in our insulin pump, this is the code for insulin pump, but it's 50 units. We need 100 units. So it will be times 2, which is there in option C, which will be our answer. But still, let's look into other two options. What is J1815? Injection insulin per 5 units. No, we need insulin pump. And what is in option D? J1835. 1835 represents injection itraconazole 50 mg. No, we need insulin pump. Which we got the answer as option C. J1817 times 2. Because in single code it is 50 units only. And in our question it is 100 units. So times 2. Now let's look into modifier question. Two modifier questions from HCPCS. Okay. HCPCS modifiers. So moving on to 9th question. A very large lipoma is removed from the chest measuring 8 square centimeter and the defect is 12.2 centimeter requiring a layered closure with extensive undermining. Image is performed by a medically directed CRNA, certified registered nurse anesthetist. CRNA, you may be getting short forms like this. They might not be mentioning the abbreviation. Okay, CRNA code the anesthesia service. So here we need to code for the anesthesia service. Okay. So what is the first option? 00400. Here anesthesia code we have only two. So first let's identify which is the exact anesthesia code. Either 00400 or 00300. What is 00400? Anesthesia for procedures on thorax, chest wall and shoulder girdle. Here, yeah, chest. Here anesthesia. See, lipoma is removed from the chest, right? So this is anesthesia for chest. Still, let's look into what is the next anesthesia code. 00300. It represents anesthesia for procedures on the neck. That's not the one. We need the anesthesia code as 00400. Okay, anesthesia in the chest. Anesthesia for chest. And what does this QS and QX modifiers? QS and QX. We need to identify whether we need to code both QS or QX modifier or only QS. What is QS modifier represents? Monitored anesthesia care service. And QX represents CRNA service with a medical direction by a physician. Yes, we need CRNA service, right? Because it is performed by a CRNA. So both modifiers should be marked. So our correct answer is option A, the anesthesia code 00400 with modifiers QS and QX. Okay. So let's move to one more question. 10th question. A healthy 32-year-old with a closed distal radius fracture received monitored anesthesia care for an hour of the distal radius. What is the code for anesthesia service? So here, closed distal radius fracture. Okay. So we are the patient is getting anesthesia for closed distal radius fracture. Let's look into the anesthesia codes 01830 and 01860. What is 01830 represents? Anesthesia for open or surgical arthroscopic endoscopic procedures on distal radius, distal ulna, wrist or hand joints. Yes, we need distal radius, which is there in 01830. Still, what is 01860? 01860 represents same anesthesia for forearm, wrist or hand, cast application. This is not cast. So our correct anesthesia code is 01830. And here monitored anesthesia care, which is the modifier QS as discussed in the previous question. Okay, monitored anesthesia care. So QS also should be coded. And a healthy patient, it's a healthy 32-year-old patient. So P1. P1 represents physical status modifier in the normal healthy patient, right? So the correct answer is option C. 01830 QS modifier and P1 modifier. Okay. So these are few important mock questions from HCPCS that you might be encountering. You will be getting 3 questions from HCPCS. You can easily score 3 marks. So friends, if you like the video, please like and share and please support me. And if you are new to the channel, please subscribe and please press the bell button so that you will not miss any notifications. And let's discuss few more mock questions, more and more mock questions in the upcoming videos. Thank you so much friends. Stay tuned. Bye.